It's no surprise that ERs are filling up, and one Middle Tennessee doctor is sounding the alarm.
News 4's Tosin Fakile talked to her today, and Tosin, this means a much longer wait for people needing to get to the ER, and we understand she actually just dealt with a full emergency room.
That's absolutely right, Tracy and Marius. And to put it in perspective for you, Dr. Katrina said pre-pandemic, most hospitals would have a goal of seeing people in the emergency room within 30 minutes. Just 2 days ago, Dr. Green says her ER waiting room was full of COVID patients and people had to wait hours to be seen. And on top of that, she says some hospitals were temporarily full and on diversion. Dr. Katrina Green said on Monday she does not believe they got back one negative COVID test from patients waiting in the ER.
Which is the concern, patients who have COVID and are sitting in the waiting room, are they wearing a mask? Are they not wearing a mask? Are they coughing? Are they spreading it to other patients who don't have COVID? So the waiting rooms are kind of becoming a place where you could possibly get sick.
Adding to a full emergency room, her hospital was receiving ambulances from other hospitals that were on diversion.
I was noticing they were bringing patients to my hospital on the other side of town. So I asked them, what's going on? Why are you guys over here? And they told me my other hospital that I had worked at was on diversion, which means that they are at capacity and can't take any more patients. So whether or not that is the hospital is actually full, or if it's just a staffing issue, that they're at the capacity that they can staff the beds, I don't have insight into that.
And she says the effect isn't just taking a toll on those who need medical help.
We have to stay home when we're sick because we don't want to expose our coworkers, our colleagues, and our patients to the disease, to the virus. So, that places an extra burden on the staff that's there.
Green says a quick self-assessment could go a long way with unburdening any ER. If you feel unwell but not bad enough to go to the hospital and need a COVID test, there are other options besides an emergency room.
There are places all around town where the Metro Health Department has set up clinics where you can get a free COVID test. It's overloading our waiting room.
Yeah, Dr. Green said a lot of people showing up just needing COVID tests, and that's definitely part of the problem. She also is asking people to still wear their mask and also get vaccinated and boosted. Tracy and Maria, she says majority of the patients admitted to the hospital right now and sick with COVID are those who are not vaccinated or haven't gotten that booster shot. Back to you.
We continue.